statisticians and its component society, the Philippine Society of Microbiology and Infectious Diseases. We welcome you to this morning health forum.
Good morning. Good morning.
Morning.
We'll provide you an update on the current para ayaw ng microphone. On the current status and how many cases are we actually monitoring as far as the MERS-CoV is concerned. As of this time, we only have one confirmed case, our index case, our nurse, and apparently is in a stable condition right now. So binabantayan po natin siya. Ang magiging indicator kasi natin as to when to discharge our patient is pag tulad ng pinaliwanag namin sa inyo, pag nag-negatibo na ang laboratory test na ginagawa sa kanya. So other than that, she's not showing any signs of distress. We refer the case as well to OB to monitor as well and to take care of her pregnancy. Now, we told you when we had our press conference last Sunday that we will update you the 3 other cases that we are actually monitoring. The other one admitted at RITM, we can actually safely say that it's not MERS-CoV. So he was admitted simply because he's a facial pneumonia, right? And we need to address the pneumonia as well. So it's not MERS-CoV. The PUI, the person under investigation, she manifested some signs kaya siya inadmit din in one of our hospital. Initial test results showed negative as well. But then we need to do another test. Sabi natin, di ba ganun, pag negative, kino-confirm natin ulit when the patient gets to show some signs and symptoms. But initial test is negative. Now the other one, yung pinaliwanag sa inyo ni Secretary before, yung suspect case naman natin, after 2 tests, we can safely say as well that it's not MERS-CoV. So, as of the moment, ang status natin, we only have 1 MERS-CoV. Yung nurse natin. So, yun po yung update natin regarding the 2 other cases. And probably, we're going to entertain your concerns as we go on na lang, yung mga questions. Thank you.
Actually po, yung tungkol po dito sa mga disease natin, MERS-CoV, ang naglilid po dyan sa overseas ay ang ating embassy under the Department of Foreign Affairs. Ang ating pong Foreign Affairs ay nagbigay na ng circular sa ating as early as May 9, 2014. May circular na to all Philippine embassies in the Middle East on measures to contain the MERS-CoV. For instance, ang sinasabi po nila dito, all OFWs in distress whose repatriation will be charged against the ATN and DOL should undergo MERS-CoV testing before they are repatriated. So meron namang measure tayo na ginagawa. Dito naman sa Pilipinas, we have issued the OWA issued a circular to all Philippine recruitment agencies, accredited PDOS providers na about measures to be undertaken to contain or to prevent the further, or when they are already in the post in their countries of destination, to prevent MERS-CoV infection.
siguro we will entertain na para ma-facilitate na. I'm pretty sure you had quite a number of questions in your mind that you wanted to address. So, i-open na natin yung floor for discussion. So, kung wala pong katanungan.
Kumusta yung contact tracing na ginagawa sa mga kasabay sa plane?
Well, yung contact tracing natin ended last Sunday kasi tulad na nabanggit natin, ang consideration natin dito is the incubation period from the time na na-expose sila. The exposure was on February 1 at kung bibilangin natin yung 14 na araw, natapos na siya ng February 15. So tinapos namin ng February hanggang Sunday, actually up to Sunday, ang ginawa natin contact tracing. But then for those other passengers na we may not have been able to contact, kung may mararamdaman, gusto natin pa rin makipag-coordinate sila para makita kung ano yung ba ang problema nila. It may not be MERS-CoV, but there might be some other conditions na that is equally important na kailangan din i-address.
Yung isa po na naiwan pa nun siya, nakauwi na rin ba siya?
Pneumonia na yun, siguro ihiwalay na natin na para hindi na magkaroon ng confusion din yung mga tao. Kumbaga sa kaya lang siya nasa ospital dahil sa pneumonia problem niya na. It has nothing to do with MERS-CoV anymore. Yes, ma'am?
Yung po bang pagdating ng mga galing sa Middle East, automatic, tingnan niya talaga sila pagdating nila para makasigurado ang DOH na sila walang dalang virus.
Ma'am, ang dumarating po kasi ng Middle East ay umaabot po ng halos 4,000 araw-araw. Kung titingnan natin araw-araw din 4,000 yan, magkakaroon ng spillover yan. Baka humaba ang pila sa airport at hindi realistic na gawin. At never naman ginawa din ito kahit sa airport at anong bansa. Ang ginagawa pa rin ang pag-screen, although noon pa man, time and again, palagi namin minimension that the thermal scan will only detect changes in your body temperature. Because there's always been a lot of concern bakit hindi nakita ng thermal scan. Ay hindi po magde-detect ang thermal scan na pag dumaan ka sasabihin doon MERS-CoV, MERS-CoV, MERS-CoV. Wala pong ganon. Ang magbi-blink lang doon, makikita pag may pagbabago sa temperatura ng katawan mo. Suffice it to say na nung dumaan itong kaso natin or probably other passenger na dadaan doon, kung walang lagnat, walang makikita. So, paano ang next step natin? Ang next step natin is really to encourage them na kung may pagbabago sa kanilang pakiramdam at galing ka sa Middle East, magpatingin ka kaagad at i-volunteer mo kaagad sa doktor mo na may history of travel ka nang sa ganun makonsider naman ng doktor na isa sa diagnosis yung MERS-CoV. So, posible talaga maaring nangyayari na may dadaan na nakakalagpas dahil kung nasa incubation period ka pa lang, tinatag natin yung 14 days incubation period, inaasahan natin na maaring wala pang sintomas, na maaring nandito na siya pagkaraan say ng 3-5 araw, tsaka lumitaw ang sintomas, na pag dumaan napakasigla, na talagang hindi makikita yon.
Pero kung concern ko daw yung mga susundo sa kanila, ano daw po yung mga dapat nilang gawin? In case kasi hindi naman natin sigurado kung paano sila
Ayaw din natin mag-create ng confusion naman. Baka na mapaglabas ng airport, lahat na lang nakasundo doon nakamask. Mali din naman yung ganong approach. Siguro, ang talagang ano lang dito, iwasan na rin natin yung Pilipinas lang yata may ganong kaugalian no? Na pag may umuwi sinusundo din naman sa ibang bansa, pero yung ganoong karaming sumusundo na may parang may kapistahang pupunta, siguro iwasan na rin yan kasi remember nung una nating threat ng MERS-CoV last year nung Holy Week, lahat ng sumundo sa kanya were also subjected into yung di ba kinonfine natin sila nung na-confine sila for 14 days din yon. So para maiwasan yung mga ganung pangyayari, maaari sigurong ilimit na lang natin ang susundo at kung may pagpalagay na rin natin, may bigla lumitaw na sintomas sa biyahe, ituloy na rin nila sa doktor, ospital, para bago umuwi, mabawasan ang posibleng exposure, mapatingin din kaagad.
Sir, yung dalawa pong pasahero na nag-negative na sa...
Yes po, yun ang binanggit natin kanina. kung wala ng ibang nararamdaman, kasi kaya sila na-confine, di ba? May nararamdaman. Kung wala na't i-clear na sila, madi-discharge. But we can safely say it's not MERS-CoV anymore. Yun naman ang importante sa atin as of now. Whether it's MERS-CoV or not. It's not MERS-CoV, maaring may trangkaso, may flu, na that should be addressed as well.
Actually, yung tanong kanina, yung anong ginagawa natin doon sa site, sa foreign post. Meron tayong advisory, merong advisory na binigay ang DFA sa mga protocols para ma-avoid natin yung MERS-CoV. Pinadala ng DFA yan through the embassy sa ating mga Filipino communities. Tayo din, nagpadala din ang ating Department of Labor and Employment ng advisory sa ating mga Philippine Overseas Labor offices para gano'n din, i-disseminate itong mga in-establish ng ating Department of Health na protocols. Kaya ngayon, ang ating puro paghihimok lang ginagawa natin sa mga uuwi at magbabakasyon na galing dito sa ating mga countries na na-identify na sources ng MERS-CoV, na himukin sila na magkaroon ng MERS-CoV testing at least 2 weeks before they depart for the country. So yan ang ating ginagawa ngayon through the auspices of the embassies abroad. Hindi lahat. Yung pinopondohan ng ating ATN, ng ating Department of Foreign Affairs at saka ng Department of Labor. Yung mga uuwi ay pina-test natin muna bago umalis. Hindi, yung in-distress lang.
Ano na pong update kung pinag-uusapan daw na mandatory testing sa mga OFWs from Middle East communities from the government versus labor? Posible ba yun, sir?
Medyo pinag-aaralan pa natin yan kasi hindi naman tayo ang gagawa niyan. Ibig sabihin, hindi dito ang gagawin, doon yung gagawin. So we have to relate to the authorities abroad. Kasi kumbaga, papasok tayo sa kanilang mga protocols, ay kailangan nating malaman kung posibilidad dyan sa kanilang under the rules and regulations.
Siguro, if I may add, doon sa tanong ni Dominic. Ang problema, ang magiging concern kasi dito, hindi porke na-test sila negative before get to arrive here means that they're negative. Ang problema kasi doon, what if the exposure was actually, say, a day before he left for the Philippines. So meron pa tayong 3 to 14 days na maaring ma-develop ang sintomas. So yung kung i-weigh natin, ano ba, makakatulong ba talaga o hindi, it will provide us with the false sense of security kasi. Na baka naman, negatibo naman ako, hindi ito MERS-CoV, maging lax naman ngayon sa nararamdaman nila at hindi na nila bantayan din ang kanilang ang sarili nila.
Yes, Doc, doon sa tatlong nasa RITM, sino na yung passengers na yung contact?
Tatlong nasa RITM?
Di ba sabi niyo, tatlo pa yung nasa RITM?
Dalawa lang.
Dalawa. Plus that.
Plus the index case. The index case,
Wala na yung dalawa.
plus yung exposure ng hospital yon na pneumonia na clear na natin. So, ang we need to validate kasi kiniklear pa nila din naman kung i-discharge na o hindi. Plus the 2 other cases na kasama naman sa plane yung dalawang yon. Yung explain ko kanina na nasa ibang hospital yan.
Pinakatanong lang po sa regional network namin, another suspected case of MERS-CoV confined at Cotabato Regional Medical Center, especially the patient experience severe fever and trust in CR, MC later confided in isolation.
Actually, marami kami natatanggap na, well, siguro, dahil heightened ngayon ang ating awareness, and ito yung consequence na. But then, gusto natin mangyari naman yon na maging cautious sa nararamdaman nila. So, filter din namin kung alin ba talaga doon ang mukhang MERS-CoV. Kasi hindi naman lahat na nanlagnatin din ngayon na dumating MERS-CoV din kaagad. So, this one, lahat ng naman ng report, which we like. Kasi nga, para makasigurado tayo, tingnan natin if they would fall under doon sa mga na worthy of considering whether it's MERS-CoV. But then, that doesn't mean to say na porque hindi sila MERS-CoV, hindi rin i-address yung concern nila.
Doc, alarming ba talaga ito? MERS-CoV kasi sinasabi ng DOH hindi na nakaka-alarma. Para malaman ng publiko kung talagang alarming.
Natakot din ako sa pagkakatanong at para ako biglang na-alarma din. Napagalan ako. We do not want to use the word alarming. But then we have to be conscious of what's happening within our surroundings. Alarming is such a strong word na baka mag-create naman ito ng mga iba-ibang reaksyon na ikakataranta, ikatatakot ng komunidad na ayaw natin mangyari. To the point na pag nag-a-advise na kami, baka hindi na maniwala dahil nangibabaw na yung takot. But then, ayaw din nating mawala ang pangamba dahil kung may pangamba, andoon yung binabantayan mo ang sarili mo at sinusubaybayan mo yung mga pangyayari mo sa paligid mo para alam mo ang gagawin mo. So, ang endpoint lang, what I'm trying to drive at is that make sure na updated ka sa nangyayari, doon ka lang sa facts, at sigurado naman magpapayo ang kagawaran ng kalusugan through our Secretary Galin, na kung kinakailangan na bang magsuot ng mask, may mga kailangan bang ganitong measures, we will provide the advices, definitely. Simply because, pag ito lumawak ang problema, kami din naman ang problema. Hindi namin pinapatay ang issue, hindi ganun ang dahilan doon. Ba't namin papatay, tapos biglang lumalawak? But then we will provide guidance. So, hindi dapat maalarma, pero gusto namin din mangyari, ma-involve ka din sa nangyayari sa paligid mo by updating yourself at makibalita.
Yung dalawang kayuhan po na nasa Palawan, meron ba kayong monitoring doon?
Sabi nga natin, kung nakasama sila sa flight and apparently wala namang nararamdamang sintomas na at tapos na yung 14 days period na incubation period, we can safely say na kung may lumitaw man next week na sintomas sila, hindi na MERS-CoV yun.
Pero natukoy niya kung nasaan yung dalawa.
Nabanggit na yata naman nila kung nasaan sila. But then sabi nga natin, lumagpas na yung 14 days. So, hindi na natin iano yun na baka ikatarantap din po ng mga taga-Palawan yung binabanggit natin dahil lagpas na naman yung 14 days from the time of exposure.
Saudi Arabia, isa from Jordan. Yung domestic helper from Jordan.
Yung Jordan, kung sumusubaybay din kayo sa aming mga press conference, kinlear na po yun last Sunday na yung fever sort yun kinlear na yun na hindi siya nag-fit sa investigation natin ng kung MERS-CoV o hindi. Yung isa naman, saan lugar yan? Lahat ba saan siya ngayon? Hindi, nasaan siya ngayon? Kasi marami ang dumarating galing Saudi Arabia, ma'am. Oo, i-clear natin. Wala kaming flight attendant na minomonitor ngayon, but then sabi nga natin kanina, tulad na nabanggit ko, maraming na i-refer na ngayon na may mga lagnat, at doon gusto natin i-filter base sa history na pinadadala na sa amin, then we get to categorize them, ito worthy of baka MERS-CoV ito hindi, iba problema. We have to check on that. We have to check. Pero kung ano naman, ito naman na talagang gusto natin mangyari, di ba? Na at the earliest time na lumitaw ang sintomas nila, magpatingin ka agad, tapos kung mukhang MERS-CoV, sinasubject naman din agad-agad sa testing yan, yun ang magiging proseso natin eh. Pag lumitaw ang resulta na, wag naman, lumitaw na, say, positibo sa MERS-CoV, that's when the next step comes in. Like yung contact tracing ka agad. Pero habang may ganyang, say, kunwari may na-refer, habang hinihintay resulta, ang ginagawa naman ng Department of Health para hindi rin mabigla, inaano na namin din ng mga datos, halimbawa anong flight ba siya dumating, makakakuha naman kami ng manifesto, sino ba yung makasama, para pag na-push yung button na highly MERS-CoV siya, takbo na yung system. Hindi yung may resulta, tsaka lang kukunin yung mga dapat na information.
Ano pa, maliban sa response, ano pa yung ginagawa ng response sa pinamagaling na yan?
Maliban saan po, ma'am?
Information. Maliban sa response.
Ay, ma'am, hindi lang po presscon ang ginagawa namin. Actually, presscon po ito ng PCP na sumabay kami. Apo, hindi lang po presscon ang ginagawa namin para matagal ang agam-agam. Actually, yung iba sa inyo alam na pumunta pa kami ng San Pedro actually personally to address yung concern nila doon. So, yun ang po tinatanong nyo para makarating sa baba. Pumupunta kami mismo ng community, kino-convene namin sila. Actually, last Friday, some of you, alam niyo ng iba dito, na nandoon kami nung last Friday together with the Secretary. Kinausap namin ng community para i-assure na, we do not want to be too reassuring as well. But then we just wanted them to realize na ginagawa naman lahat ng government, lahat ng effort ng government para ma-address itong problemang ito. So, we get to go to the community. Nag-i-immerse kami, ma'am. Apo. Yun ang i-validate natin yung data kung ilan ng Filipino daw. But then, we, just for your information as well, last week, nagkipag-meeting na rin kami with some of the manpower agency dito na nagpapadala ng nurses abroad, specifically sa Arabian Peninsula, para i-raise the concern, baka medyo lumuwag din sila. And in fact, today may meeting again with them para lang tignan yung proseso kasi are our nurses being protected as well? Kailangan yun eh, kasi baka naman hindi nila bibigyan ng sapat na protection. So, kailangan din makita yon through our manning agencies. So, tinitignan din yan.
Yeah, actually, hindi ito separate with the DOH. Ang ginagawa namin, sineseparate namin, of course, yung mga various like sinabi ni Lindon, yung tungkol sa saang agency sila, sinong agency ang nagpadala sa kanila sa Saudi para we can give due responsibilities to them. Ano? Pangalawa, saan sila? Anong region, anong address, at yun, nakikita namin yun. Kaya kung kailangan ng natin sa DOH ang ganitong mga datos ay pwede namin ibigay sa kanila.
Dagdagan ko lang, kaya siguro na contact tracing yung ginagawa po ng partner natin from OWA. Remember, di ba, with this flight, umapila na naman kami doon sa health declaration checklist na naging basihan natin on how we're supposed to contact or locate yung mga nakasakay sa same flight. Umapil na kami ulit sa ating mga kababayan na umuwi ng Pilipinas. So, not only Filipinos, I mean, but then other travelers, na to please fill up the health declaration checklist properly. Kasi ito ang nagiging basihan natin. Tulad dito, nagka-problema nun sa B860. Kung hindi nila fill upan ito ng maayos, legibly and everything, wala tayong magiging basihan kung paano sila hahanapin. Maaring nakuha nilang infeksyon, at habang din namin sila nakokontak, maaring patuloy nilang in-expose ang pamilya nila. Doon po pumapasok din ang OWA at iba nating ahensya tulad ng POE as well, na binibigyan namin sila ng lista na hindi namin nakontak kasi baka OFW sila, hindi wala tayong information. na maaring nasa listahan nila na baka maaring makapagbigay sa atin ng datos sa information paano sila malalocate.
May bang sabihan yung mga from Saudi Arabia na pag-uwi nila, siguraduhin na nilang wala silang mga sakit. Kung may sakit man, ano bang dapat natin sabihin sa kanila?
Well, kahit naman siguro, kahit sino naman, ang ayaw naman sigurong umuwi ng may masakit, di ba? Hanggat maaari, but then you can never assure yourself, kahit naman sarili mo maaring na-expose ka, lalo na kung sa hospital ka nag-aalaga, lilitaw lang yung sintomas after a while. So, there's really no way for assuring o sinisigurado na may sakit ka o wala. Ang importante, pag umuwi sila dito ng malusog at bigla nagkasakit, ang napaka-importante is magpatingin ka agad. Ang ano kasi natin dito is improving the health-seeking behavior. Na the earliest time na magpatingin, magawa ka agad ng paraan, yung posibilidad na kumalat ang sakit o magkaroon ng karagdagang exposure, nalilimita. Hindi lumalawak yung problema.
Ano tayo handa sa mga ganitong klaseng sakit na parami ng klase?
Okay, ma'am. No country can ever claim, I've always been reiterating this kahit no pa sa mga press con, no country can ever claim that they are 100% in addressing any form of, sabi nyo nga, mga emerging infectious diseases. The mere fact that we're using the word emerging, sometimes you may not even know kung kailan to darating at kung ano yung darating. Ang handa, siguro, ganun pa rin ang sasabihin ko, the country is in a better position now to address this because of what they've experienced before. Marami naman tayong pinagdaanan SARS, H1N1, yung threat ng Ebola. Marami kaming hinarap na iba-ibang opinion tungkol sa mandatory quarantine. But how we're supposed to do it? Yun ang tingin namin na kailangan para hindi kumalat ang problema. Itong MERS-CoV. So lahat yan, as we go on, there's always a room for improvement para mas mapaganda din ang sistema, para mas maging mabilis ang pag-responde nating lahat ng government. But then, sabi ko sa inyo, at the end of the line, hindi natin kayang gawin lahat ito unless we get to involve ourselves as well. So, the government cannot do this alone. We have our partners. That's why one way of really showing you na may partnership din kami, say by way of different medical societies like PCP, the main fact that we're here, where we're supporting each other, is sa mga clinical side naman, sinusuportahan nila kami. Sa community, sa pagkakalat lang ng tamang impormasyon, hindi mga maling impormasyon na magdudulot ng pangamba, ng problema sa komunidad. So ito, hindi namin kaya na kami lang, but then it will make us more ready now if you get to participate and involve yourself as well.
Evangelist na medical specialty hospital na i-research mo pala yung pasyente. Yung lahat ng mga pasyente dun sa Evangelist na hospital, i-research at simula na yung disinfection ng DOH.
Ongoing ang proseso ng pag-disinfect naman sa kanila. Sabi nga, hindi naman agaran na isang building ma-disinfect mo naman. But then, definitely, it's together with our regional office and WHO providing them with the technical kung paano gagawin niya. Yes.
Today we consider this one case not alarming. But this is a virus, so ang posibilidad na mag-spread ito. Okay. We would like to hear an update on what the government, specifically the department that is doing now in terms of preparation, just in case na ito po ay mag-spread. Ano po?
Ganito sir, i-clear din natin yung regarding the spread. Well, yes, we all know that it's a virus, but then it doesn't spread through air. It's not airborne. I guess for the others, been reiterating it's not airborne. It is through respiratory droplets that you are directly exposed to someone na may MERS-CoV that you are actually at risk of acquiring the infection. Yes, but then, what? Exactly. That's the importance of you not only protecting yourself but rather protecting others as well. That when you are sick, you close your mouth when you cough so that you do not spread the virus. So it's not the government, it's your own behavior and attitude. Tulad na nabanggit ko kanina sa sagot ko, na hindi na kahit gawin lahat ng effort ng government, if the person himself will not participate in what we want, mahirapan tayo. Now, what are we doing? Like what we were asking before, para mapigilan ito, or paano i-address yung concern? Yes, we know the threat is there. And in fact, there's a lot of threat. It's not only limited to MERS-CoV. There are quite a number of diseases in other countries that will actually be a threat to our country as well. What's important is that we provide the proper information to the public so that they may know what they're supposed to do. We encourage as well the public to participate to prevent the spread of the infection. We have our facilities ready to address possible cases. We have our communication line open to address questions as well kung may mga issues. We have our different logistic or supplies like personal protective equipment to protect you and the health workers as well attending to the people, to the cases. The community, we get to coordinate with them. In fact, we get to immerse ourselves as well to the community for them to get the facts. And by knowing the facts, you should be able to know what measures you should be implementing. Let's not limit the measures to the government alone. The measures should be as a shared responsibility between the government and the community. I guess you all agree with that. It is a shared responsibility. Kahit mag-ingay kami na mag-ingay, gawin namin lahat ng measures na dapat implement. Kung si Juan at si Pedro, ang mission niya ay ikalat ang sakit, mahihirapan tayo. So it's a shared responsibility between the community and the government for us to be able to have a better, a healthy community.
All right, we would like to remind all our healthcare providers to do very good medical history when they have patients with flu-like symptoms. Always ask for contacts with those who have been to particularly the Middle East. And for everybody, basic lang naman din eh. Paulit-ulit nating sinasabi, wash your hands, cover your mouth when you sneeze, and when you cough. And then, of course, kayo na mag-isolate ng sarili ninyo after having gone to the doctor at kahit whether it's MERS-CoV or not, try to isolate yourselves para makontain yung virus. Basic lang yon. Washing of the hands, number 1 yan, and then covering your mouth. When you sneeze, sobrang daming respiratory droplets ang kinakalat mo. So, make sure you have your tissues with you, in your pockets, for any eventuality na maubo ka, magsinga, always cover your mouth. Yun lang yun. And of course, be careful handling yung mga doorknobs and pagpinto sa elevator. Studies have shown na ang pinakamarumi ay yung pagpindot ng elevator, ng ilaw at saka ng doorknob. Especially sa toilets din, ganun din. So let's not just, delegate this to the Department of Health or our government. Everyone should contribute to the containment and prevention of MERS-CoV.
Negative naman yung unang yung test. Gusto lang natin na 2 consecutive tests na mag-negative para lang masigurado. Sputum pa rin. Yes. Yung una, pagbigyan nyo naman si Cha, dinadaan nyo sa laki nyo. Eh, oh. Yes, Cha. Lakasan mo kasi, Cha. Wala naman tayong magagawa doon dahil obligasyon din naman nila ng ating mga partners, mga kaparian yung magbigay ng sakramento sa mga may sakit. But then, suffice it to say that the Department of Health provided as well proper information kung na
ang sabi
yung
niyo,
risk
so,
na
bago
may
yung
expose sila.
kaso na yun, ang sinasabi lang yung pilay pa rin. Pilay.
Wala nang tanong.
Sige, nakatambay po.
Salamat po. Gusto ko namin pasalamatan si...
Hindi ba diversionary tax? Kasi may sinasabi na yung Fallen 44 hindi na-divert lang daw dito sa nag-araw-araw ng DOH na
Ayaw ko na
nag-rescue.
lang sagutin niya, parang ang layo naman.
Diretso mo na lang interview si Doc.
Kaya sagutin ko na rin yan. Tulad niyo sir, parang galit na galit siya sa pagkakatanong niya. Hindi tayo kagamit ng ganitong problema. We find it so really amusing as well na naisip pa nila yung ganong angulo na ginagawa ito para lang ma-divert the attention. I don't think that's fair as well.
Sir, kasi tinigil ni Pangulo yung hearing sa Senado at Kongreso.
Hindi po namin masasagot yung aspetong yan.
Sir,
Huwag na natin dagdagan yung problema natin.
sa tatlo dun sa apat, nasa ICN.
Person of the Department of Health, Dr. Lyndon Lee Suey, telling us there's one confirmed case of MERS-CoV, a nurse who is in stable condition at the moment. The health department is telling the public not to be alarmed by this and instead advises everyone to just be cautious. Others are still rather being monitored, such as a second one who manifested signs, but initial results rather show negative for the MERS-CoV virus. Dr. Lyndon Lee Suey tells us and is explaining that there is a 14-day incubation period for the MERS-CoV. That's why the health department advises everyone, even the passengers they are testing, to be more cautious and alert. Also on the part of the DFA, they've said that as early as May 2014, the Department of Foreign Affairs has actually alerted embassies in the Middle East on measures to contain the MERS-CoV virus. And also they are telling passengers coming from the Middle East to fill up, honestly, the health declaration check. And also, just to give you a little bit of a background on this, the health department is saying that it's not a very easy job to monitor the passengers coming into the Philippines, as there are about 4,000 of them who arrive from the Middle East. Again, the symptoms of MERS-CoV, as you can see on your screens, are fever, cough, sore throat, shortness of breath, nausea, vomiting, diarrhea, fatigue, headache, and chills. Mornings at ANC. We'll be right back.